Have you noticed that someone in their 60s or 70s can seem perfectly healthy one month and then suddenly suffer a fall that changes everything? I've seen this happen more times than I'd like to admit in my 26 years of medical practice. A single fall can lead to a hip fracture, loss of independence, hospitalization, and sometimes a decline that families never expected. What concerns me most is that many of these falls were not caused by bad luck. They were caused by small daily mistakes that slowly weakened balance, muscle strength, reaction time, and brain body coordination. And here's the difficult part: many older adults don't realize their fall risk is increasing until after the first serious fall happens. Hi, I'm William Lee, and I've been practicing medicine for over 26 years. One thing I tell my patients every week is this: falling is not a normal part of aging. Yes, aging changes the body, but there are very specific habits and hidden health issues that dramatically increase fall risk, and many of them are preventable. Today, I want to walk you through the 5 most common mistakes I see adults over 60 making that quietly increase their chances of falling. Some of these may surprise you. In fact, number 3 is something I see even highly active older adults overlook all the time. Before we continue, I'd love to hear from you. How old are you, and what city are you watching from? And have you or someone in your family ever experienced a serious fall? I always do my best to read as many of your comments as I can, because your experiences often help other viewers realize they're not alone. Let's begin with one of the biggest and most underestimated problems. The first mistake is avoiding strength training because you think walking is enough. Now, don't misunderstand me. Walking is excellent for cardiovascular health, mood, circulation, and maintaining mobility. I encourage it constantly. But walking alone does not fully protect muscle strength, especially after age 60. After around age 50, adults naturally begin losing muscle mass every year. We call this sarcopenia, and in my clinical experience, many patients don't notice it happening because the loss is gradual. They still feel mostly fine until one day they trip on a curb, miss a stair, or lose balance getting out of bed. The muscles most important for preventing falls are the legs, hips, glutes, and core. These muscles stabilize the body when you suddenly shift weight or lose balance. Without regular resistance activity, they weaken silently. I remember a patient once telling me, "Doctor, I walk every day, so I thought my legs were strong." But when we tested her balance and leg strength, she struggled to stand from a chair without using her hands. That's a warning sign many people miss. The one thing I wish more people understood is that strength is protective medicine after 60. Even simple exercises done consistently, chair squats, resistance bands, light weights, heel raises, can significantly improve balance and stability. And here's something important many people never hear: muscle strength is deeply connected to brain health. Stronger muscles improve reaction speed, coordination, and confidence in movement. When muscles weaken, the brain becomes more cautious and unstable during walking. That brings me to mistake number 2: ignoring vision and hearing changes. Most people understand that poor eyesight can increase fall risk. But what many don't realize is how even mild vision decline changes the brain's ability to judge distance, depth, contrast, and movement. I've had patients tell me, "I can still see well enough to drive," but then admit they struggle in dim lighting, on stairs, or when transitioning from bright sunlight into darker rooms. Those small visual adjustments matter enormously for balance, and hearing plays a bigger role than most people realize. The inner ear contains structures directly connected to balance control. Age-related hearing decline is often associated with increased instability, slower reflexes, and greater fall risk. Sometimes the brain is working overtime just to process sensory information, leaving fewer resources available for balance correction. This is why I encourage regular vision and hearing evaluations after 60, even if symptoms seem minor. Myth versus fact. Myth: falls only happen because people are clumsy. Fact: most falls are linked to measurable physical changes involving muscles, balance systems, medications, vision, nerves, or brain processing speed. That distinction matters because it means falls are often predictable and preventable. Now here's mistake number 3, and this one surprises many of my patients: rushing movements. I cannot tell you how many falls happen not during exercise, but during ordinary daily transitions. Standing up too quickly from bed, turning rapidly in the kitchen, hurrying to answer the phone, getting out of the car too fast. As we age, blood pressure regulation changes, Some adults experience what's called orthostatic hypotension, a temporary drop in blood pressure when standing. That brief dizziness or lightheadedness can dramatically increase fall risk, and many people ignore these moments because they last only a few seconds. Patients often say to me, I just felt a little off balance for a moment, but sometimes that moment is enough. I especially worry about falls during nighttime bathroom trips. Low lighting, grogginess, dehydration, and sudden standing create a dangerous combination. This is why I encourage older adults to pause briefly before walking after standing up. It sounds simple, but clinically, it can make a very real difference. If this video is helping you better understand how falls actually happen, take a moment to like the video and consider subscribing. I share evidence-based health information like this every week because small preventive changes can protect quality of life in powerful ways. Now, the next two mistakes are extremely common, and one of them may already be affecting someone watching right now without them realizing it. And what concerns me most is that these problems often begin years before the first major fall occurs. One of the most heartbreaking conversations I have with patients after a serious fall is this: I didn't realize anything was wrong. That's what makes fall risk so dangerous after 60. The warning signs are often subtle. They build quietly over months or years until one unexpected moment changes everything. The fourth mistake I commonly see is taking medications without fully understanding how they affect balance, alertness, and coordination. In my 26 years of practice, I've seen incredibly intelligent, careful adults become unsteady not because of aging itself, but because of medication side effects that were never properly reviewed. This is especially true when someone is taking multiple medications at the same time: blood pressure medications, sleep aids, anxiety medications, certain antidepressants, pain medications, antihistamines, and even some over-the-counter cold medicines can increase dizziness, slow reaction time, or impair balance. And here's what many people don't realize: the body processes medications differently as we age. The liver and kidneys may clear drugs more slowly. Muscle mass changes, hydration changes, body fat distribution changes. That means the exact same dose tolerated at age 45 may affect someone very differently at age 70. I remember a patient named Robert, a 74-year-old retired mechanic. He came to see me after two falls within 6 months. Thankfully, neither caused a fracture, but his confidence was shaken badly. Robert had high blood pressure, mild diabetes, chronic back pain, and trouble sleeping. He was taking several medications prescribed by different doctors. When we carefully reviewed everything together, we discovered the combination was causing significant daytime dizziness and delayed reaction time, especially in the morning. What struck me most was that Robert blamed himself. He kept saying, maybe I'm just getting old. But after adjusting his medication schedule, improving hydration, and adding balance exercises, his stability improved dramatically over the following months. That's an important lesson I want viewers to remember. Sometimes the problem is not weakness or age alone. Sometimes it's an interaction happening silently inside the body. This is why medication reviews become critically important after 60. I encourage patients to bring every prescription, supplement, and over-the-counter medication to at least one annual review with their physician or pharmacist. And yes, supplements matter too. Some supplements can interact with medications or affect blood pressure and alertness. Natural does not always mean harmless. Now let's talk about mistake number 5. And honestly, this may be the most overlooked of all: becoming less physically active because of fear. This creates what I call the fear-fall cycle. Someone feels slightly unsteady, so they move less. Because they move less, muscles weaken, balance worsens, confidence drops further, then fall risk increases even more. I see this pattern constantly after minor falls or near falls. A patient trips once in the driveway or loses balance in the shower, and suddenly they stop walking regularly, avoid stairs, avoid exercise classes, or become afraid to leave home alone. The human body adapts very quickly to inactivity. Within weeks, muscle strength, coordination, flexibility, and endurance begin declining. And socially, isolation can worsen things even further. Less activity often leads to poorer sleep, lower mood, slower reflexes, and cognitive decline, all of which influence fall risk. The one thing I wish more people understood is this: safe movement is protective movement. The goal is not avoiding activity. The goal is choosing the right kind of activity safely and consistently. Now, let me share a myth versus fact that comes up frequently in my office. Myth: if I rest more, I'll prevent falls. Fact: excessive inactivity often increases fall risk because the body loses strength, balance, flexibility, and reaction speed. This is why some of the healthiest older adults I know remain physically engaged in daily life. Not extreme exercise, not punishing workouts, simply consistent movement, walking, light resistance training, tai chi, swimming, balance exercises, gardening, even regular household movement matters. And interestingly, one of the strongest predictors of fall risk is not just physical weakness, it's walking speed. When people begin walking more slowly, cautiously, or unevenly, it can sometimes reflect underlying balance, neurological, cardiovascular, or muscular changes. That's why I pay very close attention when family members tell me things like, "Doctor, mom just seems slower lately. Dad shuffles more than he used to. He holds onto furniture while walking." Those observations matter. Here's a quick countdown of the top warning signs I tell families never to ignore after age 60. Number 5, frequently bumping into walls or furniture. Number 4, trouble standing from a chair without using the hands. Number 3, feeling dizzy when standing up. Don't miss this one. Many people dismiss it as normal aging, but it absolutely deserves attention. Number 2, walking slower or shuffling more than before. And number 1, a fear of falling that begins changing daily behavior. That last one is incredibly important because fear itself can accelerate physical decline. Before we continue, let me ask you something personally. Have you noticed any change in your balance, confidence walking, or strength over the past few years? Or maybe you've noticed these changes in a parent or spouse? Let me know in the comments. Conversations like these help people recognize symptoms earlier. And if you value practical, evidence-based health guidance explained clearly, consider subscribing and turning on notifications. My goal is to help people stay independent, mobile, and healthy for as long as possible. In the next part, I'm going to walk you through the exact daily habits, balance strategies, home safety changes, and medical checklists I recommend to help reduce fall risk after 60, including simple things many of my patients say they wish they had started years earlier. The good news is that fall prevention does not require perfection. It requires awareness, consistency, and a few smart daily habits that protect the body before a serious injury occurs. In my 26 years of practice, I've seen adults in their 70s and even 80s dramatically improve balance, confidence, and mobility once they began addressing the underlying causes we discussed earlier. And I want to emphasize something important here. It is never too late to improve stability. The human body is remarkably adaptable, even later in life. So let me walk you through the practical fall prevention protocol I often recommend to my patients over 60. Let's begin with the most powerful step of all. Number 1, build leg strength consistently. If I could prescribe one thing universally for healthy aging, it would be maintaining muscle strength. Strong legs protect independence. Strong hips protect balance. Strong core muscles protect posture and reaction time. I tell my patients this every week. Your muscles are like a retirement account for mobility. The earlier and more consistently you invest, the more protection you have later. You do not need to become a bodybuilder. Even 2 to 3 sessions per week of gentle resistance exercise can make a meaningful difference. Some of the safest and most effective exercises include chair squats, heel raises, wall push-ups, step-ups, resistance band exercises, simple balance drills while holding onto a stable surface. And one exercise I especially like for older adults is practicing standing from a chair without using the hands whenever safely possible. That movement directly trains muscles needed for daily independence. Now, if someone already has severe arthritis, dizziness, or neurological conditions, exercises should be tailored with guidance from a physician or physical therapist. Number 2, make your home safer. Many falls happen inside the home, especially in familiar environments where people become less cautious. The highest risk areas are usually bathrooms, bedrooms, stairways, poorly lit hallways, and loose rugs are a major issue. I've seen far too many preventable falls caused by rugs sliding unexpectedly underfoot. Here's a simple checklist I encourage patients to review. Remove loose rugs or secure them firmly. Improve nighttime lighting. Install grab bars in bathrooms. Keep pathways clutter-free. Use non-slip shoes indoors if balance is unstable. Avoid walking in socks on slippery floors. Keep frequently used items within easy reach. And please be careful with ladders or step stools after 60. Many serious injuries begin with a seemingly harmless attempt to reach something overhead. Now let's talk about something many people underestimate. Number 3, protect your balance through hydration, sleep, and nutrition. Dehydration is one of the most common hidden contributors to dizziness and falls in older adults. As we age, the sensation of thirst often decreases. Some adults simply stop drinking enough fluids without realizing it. Even mild dehydration can affect blood pressure, concentration, muscle function, and reaction speed. Poor sleep creates similar problems. When the brain is sleep deprived, balance and coordination worsen significantly. Reaction times slow, judgment becomes less reliable, and nutritionally, inadequate protein intake is extremely common after 60. Many older adults simply do not consume enough protein to maintain muscle mass. The result is gradual weakness that develops silently over time. I often encourage patients to include protein regularly throughout the day from sources like eggs, fish, yogurt, beans, lentils, chicken, tofu, or nuts, depending on their dietary needs. Vitamin D also matters tremendously for bone and muscle health, although supplementation should always be individualized with medical guidance. Myth versus fact. Myth: falls are just accidents. Fact: most falls are linked to modifiable risk factors involving strength, medications, balance systems, environment, sleep, hydration, or chronic disease management. That distinction is empowering because it means there are concrete steps people can take starting today. Now, here's the doctor's checklist I recommend every adult over 60 discuss with their healthcare provider if balance problems are developing: medication review, vision testing, hearing evaluation, blood pressure assessment, vitamin deficiencies, neurological symptoms, foot pain or numbness, diabetes-related nerve damage, walking or gait changes. And this is extremely important. Never ignore sudden balance changes. If someone suddenly develops severe dizziness, weakness, slurred speech, confusion, or difficulty walking, seek immediate medical attention because those symptoms can signal a stroke or another urgent neurological condition. I also want to speak briefly to caregivers and family members watching this. Sometimes older adults minimize symptoms because they fear losing independence. I've had patients quietly hide falls for months, so if you notice bruises, hesitation while walking, furniture grabbing, slower movement, or increasing fearfulness, approach the conversation gently and supportively, not critically. The goal is preserving independence, not taking it away. Before we finish, I'd love to ask you one final question. What's one habit you think you could improve today to better protect your balance and mobility? Is it exercise, hydration, home safety? Let me know in the comments because your answer may encourage someone else to take action too. And if this video helped you better understand fall prevention after 60, please consider liking the video, subscribing, and turning on notifications. I share evidence-based health guidance like this every week to help people stay healthier, stronger, and more independent as they age. The one thing I hope you remember from today is this: aging itself is not the enemy. Losing strength, losing confidence, and ignoring early warning signs are what place people at risk. Small daily actions, repeated consistently, can protect mobility far more than most people realize. And protecting mobility means protecting freedom, confidence, and quality of life.